There's a lot of drama in the US right now about the future of emergency medicine. Recently, ACEP released a report stating that by the year 2030, there will be a surplus of 9,000 board-certified ED docs in the United States. Everyone's freaking out and angry. In this opinionated piece, I'm going to start with basic terms. If you know this stuff already, skip ahead to cashing in and learn about various for-profit practices affecting emergency medicine today. Next comes double agency, which is about conflict of interests, and then rage pit, my favorite. Finally, we'll briefly talk about what you can do to improve the future. A private equity group is a company that convinces investors to give them money so they can buy small businesses and change how they work so they become much more profitable. They keep some of the profits for themselves and give some of it back to investors. A professional organization is a group of physicians in the same specialty who make formal recommendations about best medical practices and advocate on behalf of their members and the patients they treat. An APP is an advanced practice provider. This is someone who isn't a physician but has some medical training, like a physician assistant or nurse practitioner. Some people don't like this acronym, but I'd have the same problem with any other acronym I would pick, so give me a break here, folks. I can't please everyone. Some APPs have years of training and experience working in emergency departments. Others have much less. They may be a recent graduate or trained completely outside of emergency medicine, but have taken a course, possibly online, that certifies them to work in an emergency department. Many hospitals don't have ED doctors on staff, so they use a contracted group that hires medical and administrative staff, bills patients, and collects payment. They are not employed directly by the hospital. A minority of contracted groups are democratic. They have a core of physicians, a few experienced and supervised APPs, and some clerical staff. Everyone knows how much the group earns as a whole, how much value they personally contributed, and how the group's earnings were split between salaries, expenses, and savings. Now, in most states, the law requires that contracted groups be run by medically trained people. The idea behind these laws is to keep corporations from running hospitals from a position of medical ignorance and with only profit in mind instead of the well-being of patients. Critics argue that private equity groups have found a sneaky loophole by hiring figurehead doctors, which allows them to say, hey, we can be a contracted group with hospitals now because we have a medically trained person working with us. The problem is these figurehead doctors don't have any say in how things get done. They can't veto decisions made by the board of directors who aren't medically trained. It's all a sham so private equity groups can get around the law. Once an equity group takes over, pundits say they immediately begin maximizing profits. How? First, they reduce the expense of paying EM-trained physicians by cutting their jobs. Next, they reduce the demand for these jobs by replacing them with APPs to do the work of patient care for a much lower salary. Furthermore, seasoned and well-paid APPs are often replaced with inexperienced ones who are paid a lot less. Advocacy groups argue that the few physicians remaining can't really supervise all these APPs, but they're often pressured to sign APP charts so patient insurance can be billed more for having a supervising physician. Of course, when a patient treated by any APP is injured or dies, it's still the physician who gets sued, even if they never saw the patient at all. Critics say the whole setup is dishonest and dangerous, with patients getting worse medical care and higher legal and mental health risks to physicians, all to line shareholder pockets. Supply is also manipulated. Government-funded residencies limit the number of trainees, which makes EM-trained doctors valuable and highly sought after. Privately funded programs can train as many people as they want. Corporate medical groups are doing exactly this, creating a huge surplus of ED doctors to fill the shrinking number of jobs. Critics argue that the training really isn't that good, and today's ER docs will be quickly replaced with cheaper ones who are trained to honor the corporate bottom line instead of patient well-being. There's a lot of EM professional organizations out there. Let's imagine one called ASHEMP. They're supposed to support the interests of EM physicians and patients, but what if a private equity shareholder has an influential position at ASHEMP? Or what if they advertise for their corporation in ASHEMP publications? What if ASHEMP teaches courses on how to rapidly certify inexperienced APPs to work in emergency departments? Is this stuff okay? Is ASHEMP really working on behalf of EM physicians and patients? Or are they cashing in on the corporate model? Is it a good system with good people that just needs a little adjustment? There's a lot of disagreement. To some, the fox is in the henhouse wearing a chicken costume. There's a ton of mistrust and controversy, and it gets super mean and personal fast. Let's listen in to what people are saying. Why is it wrong for us to run an ER more profitably with fewer doctors? Do you have any proof our system results in bad patient outcomes? Well, if you're the one changing the system, shouldn't you have to prove that the new method is safe? Patients will pay the price if you're wrong. Get real. There's more than one price here. We all know the baby boom is starting to recoil into a dementia and death boom. This country can't afford to give all those patients EM-trained doctors. We need a cheaper alternative. You aren't doing this for the greater good. All this money you're squeezing out of the system isn't used to lower costs or help people. It's going to shareholders who have nothing to do with treating patients at all. You are scavenging the system to make a buck. Oh, like you really care about the system. You're just afraid our model will work and that APPs can do 95% of your job just as well as you can. You're afraid we'll prove that all that extra money and time you spent on medical school and residency didn't do much for your skills. You're a dinosaur with your eyes on yesterday's game, angry because we're showing you're not as important as you want to think you are. Even if everything you say is true, and it isn't, none of that makes you ethical. You are betraying your oaths and colleagues with forked tongues for status and cash. We're not going to let you get away with this. I think we already have. I'd like to hear what you're going to try and do about it, loser. Well, we can try and target those figurehead physicians. We can try and cut pressure on physicians to sign APP charts and assume all that liability. And this coming October, we can pressure the board of ACEP to pass resolutions on transparency and due process in full so that we can more easily expose conflicts of interest when it comes to regulating emergency medicine. There are several groups fighting for this that you can join. If we don't do this, emergency medicine will basically become like the fast food industry. People with fewer qualifications providing lower quality medical care to desperate people who really don't have another choice. It is up to us. We'll see what happens.